Getting rid of gluteal tendinopathy can take a frustratingly long time. And part of the frustration is that it's nothing specific that often flares it up. Simple things like sleeping makes the pain worse sometimes. Now, there isn't something like a one-size-fits-all treatment that works for everybody. So don't be worried if you've tried the things other people have tried and said it worked and it didn't make any difference to yours. It doesn't mean you have a special case. The treatments just don't work for everybody. So in this video, I'm going to look at the research and marry that up with our clinical experience and discuss the treatments that seem to work the best for most people. Then we're also going to look at what can you add on top. If you're not responding like you want to be responding to treatment, what else may be useful? What are the things that's likely not useful to have at all? And then the things that can actually make it worse. I will also share what we find typical or expected recovery times are for this, because it does take a long time and it can feel as if maybe you're doing something wrong if you're not seeing quick results. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you get online physiotherapy assessment as well as treatment of any type of injury, all done via video call. If you want to know more about our service, have a look at the description of this video. I'll put a link to our website there. I do just quickly want to recap what happens to your tendons when they become injured, because then you'll understand better why we say specific treatments might work and why others aren't that useful. So the big thing to remember is that gluteal tendinopathy is an overuse injury. Whenever we exercise or use our tendons, they sustain micro damage. And that's normal. It's part of the process that we grow stronger, because the body then goes, oh, there's a little bit of damage there. I have to make that area more robust and more strong. And if you give it enough time to repair, that's how you grow stronger. Think of going to the gym, for instance, but physical activity does the same thing for you. The problem comes in if you either overtrain or you do something that is much harder than what you used to, or if you're female and you're in the menopause, any stage of the menopause, the drop in hormones means that you can't recover that quickly. So any elements of those, and then the micro injuries don't repair in time, and you do the exercise again or the activity again, and then they accumulate and become an overuse injury. Now, the symptoms of that, what happens actually to the tendons, is that they become really irritated and they also lose a little bit of strength and endurance. So now they can't really cope with the normal activities you want to do because they're not strong enough, and they sound the alarm system really quickly and create a lot of pain. The important thing to remember here is that your level of pain is not correlated to the amount of damage or level of injury you have in your tendon. I know that sounds a bit weird, but the research has shown that actually, yes, pain is linked to injury, but the pain can be disproportionately high or low compared to what's seen on scans. So don't be worried. In most cases of gluteal tendinopathy, if you have a really painful case, it's just the alarm system that's really sensitized in that tendon. It doesn't mean that it's a really bad injury. But that brings us to what the best treatments are. Because I mentioned earlier that you don't have a one-size-fits-all treatment plan, but there are 3 elements that all successful plans have to actually achieve recovery. And the first of that is that it should aim and to help calm that extra sensitivity down, because there are specific ways, if you tailor your rehab and everything correctly, that the pain system goes, oh, we can just calm down. We don't have to be on such high alert. The second is we need to rebuild the strength of that tendon so it has the capacity to cope with all the activities you want to be doing. Capacity just means that it is happy, it is strong, it has endurance, it can tolerate the level you want to be doing. And your level will be different from the next person's depending on what your goals and your activities are that you like. And then the third element is that you need to build the rehab plan up to the point that it prevents you from getting it in the future again. Now, in practice, these 3 things can't be done in isolation. First, the sensitivity, then the strength, then the prevention. They all happen kind of simultaneously. If you tailor your exercise and everything to the correct level, that helps the pain calm down, and that helps it strengthen up. And all of this is already building towards where you won't get it in the future. So Although we need to respect all three of these elements, it's not something we can work on in isolation necessarily. But I'm going to point out as we go through the video why I'm saying something and how it relates to these three elements. The three treatments that should make up the backbone of any treatment plan are relative rest. It's different from complete rest, and I'll explain this in a minute. Progressive loading, which means you're building the tolerance of the tendon over time. I'll dig into that as well. And then thirdly, treatments and things you can do to dial the pain system down so it comes back to the normal levels if it is sensitized. Something I want to add in before I even dig into any of the treatments is if you have an inflammatory condition or an autoimmune condition, please check with your doctor first before you dig into any of these other treatments that that condition is settled and that it's not the reason for your pain, because those conditions can all actually create tendon pain that looks similar to gluteal tendinopathy pain, and none of the traditional treatments that work for regular tendinopathies will work if you've got an inflammatory or autoimmune condition that's actually driving the pain. So what's the difference between relative rest and complete rest? Well, complete rest is where you do very little. You try to just rest the tendon as much as you can. And in some cases that can be useful, but only for a very short period of time. It is very good at calming pain down in the short run, but in the long term, it can actually make your symptoms worse. And the reason for this is that if you rest for prolonged periods of time, your body just becomes more deconditioned and it can do less and less and less. And there's also good evidence that if you overprotect an injury and you don't want to do anything, then actually that is part of what dials the pain system up, and then the pain becomes disproportionate for the injury. So what the research is showing is that a much better approach is to not stop everything, but to bring your activity levels down for the things that really aggravate your pain to a level that doesn't push it into the red. So it's all about getting that balance right between, yes, you will likely have to adapt some things and stop certain activities for a short period of time, but you should be keeping on with the things that doesn't really aggravate it and that keep you active and that you can still do. So how do you know if you're doing relative rest correctly? How much pain should you be having? Well, you want to try and adapt your activities and bring it down to a level that only causes you a slight discomfort while you're doing it, and no more than a slight increase in discomfort in the 24 hours after, but then it settles back down and you're quite comfortable. I know saying it's a slight discomfort is not very specific, but you could class it out of 10 as well. People tend to say in the research up to 3 out of 10 might be okay. We don't really like the numbering system always, because one person's 3 might be the next person's 6. It just depends how you class it. So we prefer to talk about a niggle level of discomfort. And a niggle means I'm just aware of it, but it's not really painful, and it's not meaning that I have to now cancel other things I wanted to be doing, or I can't do my rehab because my hip is too painful. So you want to look at how it feels while you're doing something, but then it often has a delayed pain response where it flares up later that day or the next day, or in bed you often feel it. So you have to also check the 24 hours after. If it's a little bit discomfort while you're doing it, a little bit more uncomfortable in the 24 hours, but then it tends to calm down and it's not interfering with anything, then you're pitching it at the right level. If your tendon pain is flaring up more significantly and you're really aware of it later that day and it's really making you uncomfortable, and especially that night it's not feeling comfortable, then you likely need to be adapting whatever you did the day before. So always remember, if you wake up with more discomfort and it feels more uncomfortable today, it's very likely the stuff you did the previous day. And also look at what you did a few days in a row, because sometimes doing that activity when you're rested is absolutely fine. But because you did something else that tired the body out the day before that, now it's struggled to cope. So you don't just want to look at today, you also want to look at your load over the whole week. This is something that we teach our patients to do, that they think of the total training load in a week and not just what the tendon has to do in that moment, and especially everything they're doing in a day. Because if you're doing your exercises, then going for a long walk, then going shopping, it's a lot of time on your feet. And that is likely what's overwhelming the tendon everything together rather than one thing in separation. And sometimes if you just become more clever with how you put things into the day, you can achieve so much more and be comfortable. So again, there are a few things you want to be thinking about adapting because they tend to flare the tendons up more than other activities. And it's anything that puts direct pressure directly over the gluteal area or the hip bone. Anything that stretches the gluteal muscles. And we've made videos about stretches to avoid and how to adapt different positions that you don't get that stretch effect. Because when you stretch the tendon, it pushes it closer to the hip bone. And it's a little bit like pressing on a bruise that can just irritate it further. And then lastly, also any activity that works the tendon. So whenever you're on your feet, you use your gluteal tendons. So you want to think about how can I just reduce the total amount of work in a day so my tendons are happy to cope. And it may mean that actually you keep on doing your walk for exercise, but then instead of standing long hours at work, you sit down and work. So it doesn't have to mean that you have to always stop everything. It's just about being clever with how you do it in the day. We have made very detailed videos about how to adapt walking as well as running, sleeping positions, as well as sitting positions. So have a look at the description of this video. I'm going to put links to all of those resources there. And it's also useful to go to our Gluteal Tendinopathy library on our website because it's often easier to find the content there. Now you've done a good job with your relative rest. Your symptoms have calmed down to a certain level, but now we have to rebuild the capacity of the tendon. And yes, of course, it's about specific rehab exercises often that targets the glutes specifically, but it's also about everything you do in the day that loads the tendon and that you want to get back to. So we're thinking of your standing time, your walking time, the intensity you walk at, perhaps the terrain you're walking on, running if that's appropriate for you. Also, with the rehab exercises, by the way, I've done a very detailed exercise video about rehab exercises for this, so I'm not going to dig into specific exercises today. The video will be too long. Have a look at the description. I'll put a link to that one there. But the important thing with the rehab exercises is you will often see that everybody says, oh, do this and this exercise. It really works well. And then you try it and it doesn't work for you. That is actually quite common. There are loads of people who just can't get on with doing a bridge or a side leg lift, but it doesn't matter. There are many different ways in which you can strengthen the glutes and increase their tolerance, and then they can later cope with those things. I've even had patients where they just couldn't do any of the specific glute stuff at the start, and we had to literally just build up their walking and their ability of walking uphill or downstairs before they then could start with the rehab exercises. So there are many ways that you can rebuild your strength. So don't get worried if something doesn't work for you. Speak to your physio because they need to adapt the plan and create something that you can cope with over time. One of the main mistakes we see people make when it comes to their exercises and activities for gluteal tendinopathy is that they try to ramp it up too quickly. And then things just flare up. Because if you ramp your exercises up at the same speed that you would just ramp it up when you train for fitness, the pain system often just kicks off because the alarm system gets triggered and it goes, no, not happy with this. You're now making us worried. And then your pain shoots up and you get a flare up. It's not that you've necessarily made things worse physically, but the pain system is now triggered. So we need to go slowly enough that the tendon has time to adapt to all the training and that the pain system doesn't get triggered. And the more often you train at this level where you don't trigger the pain system, or just that niggle level, there's a little bit discomfort and then it calms down, then actually the pain system becomes dialed down and it becomes harder and harder to trigger it. So you will find as you recover, it takes more and more effort before it actually flares up, which is good news. And this actually leads nicely into the third treatment or treatment section, which is addressing the factors that may be dialing your pain system up and making things more sensitive than what it should be. Now, some of the most common things that can really dial the pain system up is if you keep on trying to ignore it and just push through it, especially people who do a high level of sport. You can't do that sport if you're going to worry about every niggle you feel. So you tend to be quite bad actually at rating pain and rating things as too sensitive because you're trained to just ignore it. And what happens then is the more you try to push through it, the more the brain or the subconscious brain, you have no control over this system, it is going to dial it up and say, "Hoi, we're injured. We need you to take note of this." So that's why the relative rest part comes in. Because if you apply relative rest properly and you're loading properly, that you don't push above that slight discomfort, it actually helps to calm the pain system down. The second is, we know from the research, if somebody is really worried and feel that it's a serious injury or everything they do is going to make it worse, and they're scared of an exercise when they do it, then all of those things actually puts the pain system on high alert, because now it's going like, oh, wait a second, she's really worried about this, so we should create more pain to protect it better. So if you're finding that you're really scared of things your therapist has given you, or there's things that are really worrying you, it may even be financial, that you're thinking, how am I going to work if I can't get rid of this pain? All of those things can make your pain feel a little bit worse. Now, some are easier to fix than others. If your exercises are scaring you, you need to talk to your physio, because that's not okay. Then they need to help you understand how to make it safe and how you can do it in a way that makes you feel safe with them. If it's financial issues that's worrying you, that's a little bit harder, but think of who can you ask for help or support, or at least share your feelings with in your immediate vicinity, that may be able to help you get over those stresses. And then just general stress levels. If you're chronically stressed, either at work or at home or in general, those high stress levels tend to also push the pain system up and bring it into high alert. So if you have anything that's chronically stressing you out, thinking of ways that you can address that, then that can be useful to add on to that. I have explained the pain system in a lot of detail before, so I'll put a link to that article in the description of this video if you want to know more about pain and what dials the system up, what dials it down, and how you can better achieve that. Now we get to treatments that are thought to help with tendon healing. The first one I want to discuss is PRP injections, platelet-rich plasma. There is some evidence that suggests that it can help with gluteal tendinopathy recovery, but there's very little research in this area, and it's not strong enough studies that we can definitely say it works. In practice, we find that it works for some people and not for others. But you also have to understand that it's not the type of injection that you have today and tomorrow you feel better. Often you actually feel a little bit worse for a week or so afterwards, but then slowly things calm back to normal. And after about 6 weeks, you start seeing progress where you couldn't make progress before. So with this type of injection, it's not something we would say that people should have always. And it's not something we would tell people to have within the first 3 months. They need to first give rehab a go and just see with a relative rest, because that usually calms things down very well. But if they can't make progress, and especially for the endurance athletes who just can't get that last bit of strength or over those last symptoms, then a PRP injection is something to consider. Red light therapy seems to be very popular at the moment. And yes, there is some evidence that it can help reduce pain and improve function for tendinopathies. It is not very strong evidence yet. So we definitely need better research and larger studies before we can actually say that it's definitely something worth investing in. But it doesn't seem to have much downside either. We've done a complete video where we've really gone into the details of the best settings depending on the type of injury. So if you're interested in that, have a look at the description of this video. I'll put a link to that one there. It does seem that we're in the age of supplements. You can apparently buy a supplement for anything these days. But there is some evidence that if you combine collagen with vitamin C in a specific ratio, that it can actually help with collagen renewal and collagen production. And because we know that that's very important for tendinopathies, there is perhaps a place for it in rehab. As with specific rehab studies that looked at whether they can help gluteal tendinopathy recovery, there's very little evidence to support that. But there is some suggestion that if you take the collagen with vitamin C half an hour before you do your exercises, you may get a slightly better result than if you don't take it. So if you're interested in that, again, we've done a deep dive into what the research is showing at the moment. So have a look at the description. That video's link is there as well. Then we have nitroglycerin patches. They have quite a few different names, which I'll write up here because I can't say most of them. The research on this, very little available, contradictory results at this point. So there's not enough evidence to say, yeah, they work, or no, they don't work. We need bigger studies to really say whether they're useful. What the research does seem to agree on is that they don't seem to have any bad side effects. So if you're not making progress with your rehab, it is something to ask your doctor about. But again, it's not something that we would, at this point, say everybody should be using. I left my favorite one for last. It's only my favorite because it has a very strange name. Salmon sperm injections. You'll be happy to know that they're not actually injecting the salmon sperm, but it's a specific protein that you find in it. There is some research of very small studies that show that, yes, it may be helpful for recovery of tendon injuries. But these studies are really too small to say that, oh, they definitely work. At least the studies do show that there doesn't seem to be any negative side effects from them. So because they seem to be relatively safe and at least they have been tested on humans, we would say if you're feeling stuck with your rehab, it is something you can consider. I would likely go for pure platelet-rich plasma injections rather than salmon sperm because I feel at least there's a little bit more evidence that it might be useful to use for tendons. But if you want to know more about them, we do have a full video about them, so have a look at the description. The link is there. The treatments we're going to discuss next are all things that might help reduce your pain. They do not help tendon healing in the long term, but they're very good at reducing pain. But again, they don't work for everybody. They can be useful because if you can get your pain under control, then you can get on with your rehab. Even if you can just sleep a bit better, it already makes a big difference. Massage can be useful to reduce pain if you've got gluteal tendinopathy, but it has to be very gentle usually. If somebody really digs in and really hammers the tendon specifically, it can cause quite a dramatic flare-up for people later on. So if you do go for massage, please tell the person doing it to just be gentle, because a very light, like a beauty massage, can help calm the pain down sometimes. But a strong, deep tissue massage with trigger point therapy, in my experience, usually just flares the pain up. It may be tolerated in the later days, but especially if your pain has just recently flared up, that type of massage tends to make things worse. And similarly for doing things like your own massage using a foam roller or a ball, anything like that, if you want to try it, be gentle with it, because yes, it can work for some people, but if you're going to be really strong, even over the muscly bits, not even over the tendon that's injured, it can sometimes just trigger the pain. Taping is another popular way that people try to reduce pain. There's one study that looked into that, and they looked at two different techniques for kinesiology taping. One was meant to be the proper technique to reduce pain, and the other one a sham technique. And they found that both techniques reduced the pain in the study for the people to an equal amount. So yes, taping worked to reduce the pain, but there wasn't one technique that was better than the other. So the likely conclusion here is that it was the placebo effect that reduced the pain. In my own experience, even though I know tape doesn't work for pain, I have had some injuries where it reduced my pain. And my view of this is always that tape is relatively cheap and it's easy to apply yourself. So if you're really struggling with pain, it is something I would perhaps give a go and just apply it once and see what you feel. But take note of how you feel in the days before you use the tape. Then do you notice any difference afterwards? If there's no change, there's really no use in continuing with taping. But if it does help, then it is something that you can add in. Dry needling is a treatment that I personally found worked really well for patients with gluteal tendinopathy when I was still working in a physical practice. And it worked better than massage. But it only worked if the person wasn't afraid of needles. There are 2 research reviews also that supports this, that it seems to be useful for tendon pain. The reason I said that it only works if you're not afraid of needles is because I've had a few patients who's come in, their friends told them that dry needling really worked for them, so they're feeling that they need to be brave and just have it even though they hate needles. I've always tried to dissuade them, because what happens is they just become traumatized because they're really terrified of needles. And then it brings the pain system up because it goes into high alert, and then the pain actually feels much worse. So dry needling is a treatment I would say works really well for pain if you're not worried about needles. But if you don't like the thought of a needle, it's likely not the thing for you. Then we have low-level laser therapy, which is really just a type of red light therapy, really. And there is evidence that that can help reduce your pain. Ice can be quite useful for treating pain as long as you don't overuse it. You're not meant to be sitting with the ice on there for hours and hours and hours. Tissue don't like or do well with being that cold for extended periods of time. The idea with icing is you apply it for 10 minutes, you take it off for 10 minutes, reapply it for 10, and that's the full session. You can do it again a few hours later, but you don't want to over ice the area. We have made videos about icing if you want to know more about that. Now, if you like me, you're not going to like ice. I hate being cold, but I do like heat. Heat can be useful for gluteal tendinopathy pain, but I would not use it if your injury is less than 3 months old or you have an active bursitis as well. And the reason for that is that in recent onset tendinopathy, as well as bursitis, there may be a bit of inflammation involved, and heat can make inflammation worse, which will increase the pain. But if it's an injury that's been present for more than 3 months, there likely isn't any active inflammation. The research shows that actually at that point, it's not inflammation causing any of the trouble. So then you can use heat safely. You can usually apply heat for longer than what you apply ice, but you're looking for moderate heat. You're not looking for something that's intensely hot, because again, cells don't like being too hot for too long. So you should think of a comforting heat like a hot bath or shower perhaps is a better option than sitting with a heat pack on you for hours on end. So if you're going to use a heat pack, I would say limit that to 30 minutes, and it shouldn't be intense heat. But getting into a hot bath or shower is also an option. TENS machines work with electrodes that you put on the body, and they send electrical signals. And it's not the one that makes your muscles contract. It just makes a fuzzy sensation. Those machines have been shown to help with pain, but only while they're on you and maybe for an hour or two afterwards. So the effect is short-lived. But again, if pain is really impacting your life, it's not very expensive usually to get a TENS machine off the internet, and you can get them from Amazon. And it is something that can help with pain, even if it's just while you're using it. And there doesn't seem to be a limit to how long you can use it for, but it's always good to look at what the manufacturer tells you in their booklet for their specific machine. At the moment, the research is showing that shockwave might help reduce your pain if you've got gluteal tendinopathy. There isn't any clear evidence that it actually speeds up the healing process. In our experience, it seems to work for some people, it doesn't work for others. But there are 3 things I want to highlight here. The first is that you shouldn't really be using shockwave too early on into your recovery. Shockwave is thought to work through creating small injuries in the tissue that then kickstarts the healing process. Now, in the early days, when your tendon just became painful or becomes painful, it is thought that there's a bit of inflammation involved. And that is all part of the natural healing process. So you haven't had a failed healing response yet at that point. And if you add in shockwave too early on, you can actually then create an excessive inflammatory response and just make things feel a bit worse. So it's best to wait at least 3 months and try all the load management and the careful reloading that we've spoken about, because those are the things that usually work really well in those early days. And if you're not seeing the results you want to be seeing, then you might consider adding shockwave on top. But it's also important to understand that you don't want to be using shockwave over any area that has active inflammation. So if you have a really angry bursitis that you notice is actively inflamed, shockwave is not something to be used over that area because it will likely make the inflammation worse. If you have more of a chronic bursitis, it's been going on for more than 3 months, and it's more like a grumbly bursa than an actively inflamed bursa, then shockwave may be an option. The third point is really important. Shockwave is not the type of treatment that should be used daily. Because it causes a small injury, you need to give the body time to actually react and repair that area and have its full reaction before you add shockwave in again. And there has been reports when people use shockwave daily or too often that you can actually get some serious injuries. So at the moment, the recommendation is to leave at least 4 days between treatments. But in the research studies, they tend to use it just once a week, which is also what we used to do in the clinic when I still worked in a physical clinic. And my experience, if you're not seeing any results within 6 treatments, it's unlikely that the shockwave's going to work for you. Usually, I would expect the patient to start seeing some positive results within 4 treatments, maximum 6. And if at that point it's not really clear that the shockwave is making a difference, we would normally stop. And that's what they tended to do in the research studies as well. So there's no use in continuing with shockwave just for the sake of it and hoping that it will work if you've already had 6 sessions and it hasn't worked. What about losing weight? I find when people are injured, they often want to blame themselves. And especially if they're very aware that they are more overweight than what's ideal, they tend to think that it's because I'm carrying this extra weight. If I can just lose the weight, then I'll be better. Yes, of course, carrying extra weight isn't great necessarily, and it does increase your chronic inflammation. So there is some evidence if you can reduce, especially if you've got belly fat, that can help with just general health in the body. But in my experience, that is often not the main driver in why you get gluteal tendinopathy. And it really doesn't help to then feel guilty about the fact that you're a bit overweight or you can't actually do things because you're in so much pain. So it is something that's always good for your general health to work on if you can, but it's not something I would beat myself up about. And it's not the main focus at the point when you're in so much pain to be worried about carrying a few extra kilos. The last one to mention under pain relief is high volume injections. And with these injections, they combine a large volume of just clean water, saline, with a little bit of corticosteroid and inject it into the tendon. The thinking is that it stimulates healing, but currently there's no evidence that it actually helps the tendon to heal. But it does seem to help reduce pain, and it does seem to be a safe procedure. But again, the same caution, as soon as the pain goes, doesn't mean that you now can just do what you want to be doing. You still need to progressively reload your tendon and build the strength to stop it from coming back in the future. The next group of treatments are things that only really is necessary to look at for people with very specific things going on in their cases. And the first thing I want to look at are overpronation or antipronation orthotics, arch support orthotics. Now, it's quite normal for us when we walk and run, our feet do turn in somewhat, but some people's roll in excessively. And if that happens, it can bring your leg in excessively. That puts extra strain on the gluteal tendons. The research on this, there are 2 studies that are showing contradictory results. But if you look at what they did in the studies, they gave people who didn't overpronate the orthotics as well, and it didn't really make a difference to them. I'm not really surprised at that. I wouldn't expect it to make a difference there. So I don't feel the research that's available at the moment is really worth looking at because there are flaws in the design, in my opinion. So if you're somebody who does overpronate, it's definitely looking at what shoes you wear and testing whether orthotics help. And if you can just reduce that overpronation a little bit, maybe it can help your pain settle more quickly. Hormone replacement therapy is something to consider if you're in any stage of the menopause. We know that the drop in estrogen levels makes the body struggle to produce new and stronger collagen fibers. And it's even thought to be part of the reason why women tend to get more cases of gluteal tendinopathy in their 40s than when they are younger. I know it's not for everybody, and not everybody can take it or wants to take it even, but it's worth considering discussions with your doctor if you are in this stage of your life. There are also many other things that you can do around managing the symptoms of the menopause that can help. So it's worth looking into that. We have made a video about how the menopause or perimenopause affects tendons. If you want to know more about that, have a look at the description. I'll put a link to that there. Anti-inflammatory medication can be useful if you have hip bursitis or enthesopathy, which is inflammation of the insertion of the tendon into the bone, but it's not useful for regular cases of gluteal tendinopathy, because in those cases, you don't have inflammation as part of the main driver of the tendon injury. So only if you have an inflammatory condition or enthesopathy or bursitis is anti-inflammatory medication usually worth considering. Corticosteroid injections is a little bit controversial because the research shows that they can have a really good initial pain reduction in the short term, but then it doesn't really make any difference in the long term. And there is evidence to suggest that it might not be great for tendon healing in the long term. And since gluteal tendinopathy is already something that takes so long to recover, you don't necessarily want to add that in on top if you're already struggling. However, some cases of gluteal tendinopathy can just be extremely painful and stubborn. And if your pain is really not responding and you're not able to make any progress, then it is something I would consider having, because there is research to suggest that it can help with your pain and is relatively safe to have. So it's not something I would say avoid at all cost, but it's definitely not something that I would reach for within the first 3 months, and if I've not tried any of the other treatments that we've discussed. Surgery is something to consider, and it has been shown to help with pain reduction and help people actually make progress in cases where their gluteal pain just didn't respond to anything else. And they can either just take the bursa out, if that's the problematic bit, called a bursectomy, or they can repair the tendon. Now, there isn't enough evidence in the research to say this type of patient will definitely benefit from this type of surgery. So the surgeons tend to have to use their experience to understand what will likely benefit the patient. It is also currently not advised to use surgery too early on. The thinking is that you should give it at least 12 months of trying the different types of treatments we've just spoken about, because gluteal tendinopathy in most cases do recover. It just takes quite a long time. One treatment that's gaining popularity these days is 10x treatment. Now, 10x is minimally invasive surgery where they go and remove the injured part of the tendon, which then helps reduce the pain. But it's important to understand they're not actually going in and strengthening the tendon, they're just taking the injured part away. And it's important to then, if you do get that your pain goes away after that, you still need to strengthen the tendon and have that progressive loading to stop any injuries from recurring. The current evidence suggests that yes, 10x may help reduce pain for gluteal tendinopathy, but it doesn't seem to be much more effective than PRP injections. So I would perhaps go for a PRP injection first, and if that doesn't work, then consider 10x after that, because it's more invasive than the injection is. There are some treatments that I wouldn't waste my time on. And the first is therapeutic ultrasound. Now, this is different from the ultrasound that they use to do imaging that shows you images. It's the type of ultrasound that physios typically use in their offices. And it uses gel and you just move the ultrasound head round. The research is consistently showing that it's actually just not useful for tendons. If they test it on animals, it seems to work and possibly had a positive effect, but this is not being replicated in humans really. And in my experience also, it's not something that's useful for gluteal tendinopathy. Corticosteroid tablets should really not be prescribed for anybody for a tendon injury. They are really useful for other types of medical conditions like lots of things like asthma. Sometimes people have to take that and then it can be life-saving. But for a tendon injury, it has no place. It has a much stronger effect on the system, and the evidence that it can actually cause negative effects for the tendons is much stronger for tablets than it is for injections, because the injection is only one injection, it's done very locally, and the effects doesn't last that long. Whereas tablets you usually take over a prolonged period of time. Every now and again, somebody asks me whether they should consider taking peptides, specifically BPC 157 peptides for the tendon injury. And then they get really angry with me when I say I would not take it because there's no evidence in humans that one, they work, and 2, that they are safe. Now, I know I've spoken about other things where the evidence is inconclusive, so we don't know if they work or don't work. But the key difference is that with those studies, at least, they've been done on humans, and we know that they don't have side effects. Whereas this thing has not even been studied in humans yet. So we have no idea whether it's safe or whether there's some serious things we need to be considering here. And if we think about the fact that there are other treatments that actually works, this is just not something that I would risk my health on at this point. The 3 things I'm listing in this section are things that usually makes people's pain worse. Of course, we are all different, so there may be exceptions to this rule, but the vast majority of people are better off if they don't do these things, especially during the early stages. First is stretching the glutes. Your glutes can feel really tight and uncomfortable when they are injured, and that's why people tend to want to stretch them, and they're often given stretching exercises as part of treatment plans. But in our experience, that just tends to flare them up, and the research supports this as well. And it's because you're pulling the tendons closer to the bone, compressing them against the bone, and it's like pressing on a bruise. It just makes it worse. We have a full video about this, so have a look at the description of this video if you want more about that. Second is really strong massage. And this is whether you're doing it or somebody else is doing it to you. But in my experience, strong pressure over the gluteal tendons or the muscles even can often just flare the pain up massively later on. If you're not sure if either of these are happening to you, just look for cause and effect and be aware that they often have a delayed response. So it may feel quite satisfying while it's happening, but then several hours later, your pain feels quite a bit more annoyed with life. So just experiment with it and observe what happens. And observe what happens if you stop doing it. So stop doing the stretches or the hard massage for a while and see what happens. Then the last one is prolonged periods of rest. Now, we've spoken about how rest can be really useful for short periods to help calm your pain down. But if you're going to overprotect the area for a very long period, several weeks, and not get back to actually doing the things you want to be doing, you're dialing the alarm system up and you're not rebuilding the strength, so it's even easier to aggravate the pain. So the reloading path is really important. How long does recovery actually take? Well, if there are obvious things that you are doing at the moment that's irritating your tendon and keeping the pain going, if you can cut those out, you can see a dramatic improvement in your pain in quite a short period of time. The best improvements I've seen, it's nearly like magic, is when people have been stretching their glutes for a long period of time and then they just stop it for a week or so and they can't believe how much better they feel. So if that's the case, you're going to be very happy because you will see improvement quite quickly, but then it will plateau. In cases where there's nothing specific that's irritating it and it's just the injury that's causing the symptoms at the moment, you can expect it to take at least 4 weeks, but sometimes even 12 to start seeing good improvements. So we're not talking about you're healed. We're just talking about, oh, I can finally see that I'm really getting better with this and getting better with that and to be able to do more of this and that. But full recovery, if you're lucky, takes around 6 months for mild cases that's not been around for such a long time before they start the treatment process. But if your pain's been present for more than a few months, and perhaps you've been doing a few things that's been stirring it up along the way and making it shout louder than what it should, it can often take 9 to 12 months, sometimes even up to 18 months. But it depends on how long things have been going on for, how good your loading and progressive loading plan is, and also what activities you want to get back to. Being comfortable in the house and just walking around day to day will become comfortable relatively quickly compared to being comfortable running a high volume of running or whatever sport you want to be doing. So it does also depend a little bit on what your goal is. Brilliant. Hope you found that useful. Let me know in the comments if you've got any questions. And if you need more help with your injury, you're welcome to consult one of the team via video call. The link to our website is also in the description of this video. Take care.